It's time for The Commute.
Come with me if you want to live.
Yeah, it's in its 5th year.
Close your eyes and pretend it's all a bad dream.
I keep thinking this is the last time I'll have to do this.
Evasive maneuvers now!
But here I am again.
Well, that is a sucker punch to the gonads.
All because you just keep listening.
Something's wrong with you. Really.
Is he more interesting than the guest?
This is so nuts.
I don't think so.
Listen to what you're saying.
I know, it's crazy.
It's paranoid delusion. It's really sad.
So you'll keep learning about cool jobs.
You found Wonka's last golden ticket.
And I have to bring him out now.
I request the cone of silence.
Here's your host.
I make this look good.
Steve Oliver.
Always professional, rarely affable. Dr. Steve coming to you and welcoming everybody to another Frog in the Throat inspired variation of The Commute. I am the bus driver commuting you to and from work 2 times a week. Mondays, we got Music Mondays going on. And if you look in the rear view, you can see Monday was right freaking there. And thank you to John Basaha Monday. If you like the babies, oh, you got to go back and listen to that one if you hadn't yet. What a cool guy. Today, though, man, today is Normie Thursday, where I interview someone who does everything not music related. Wait, that sentence actually didn't make sense. I interview people. Interesting people who do interesting things for a living that are not music industry related. And today, glad I finally got that thought straightened out. Today we're going back to a theme I started on New Year's Day and have had one guest since then that is appropriate to this theme. It seems about once a month. I've got different themes going here in 2021. We've got like blue collar workers popping up. We got health workers popping up, and then we still have just a random smattering of cool things. But back to health and wellness. We had Nikki Estes, who is a yoga practitioner, master. We had Dexter McCluster, who is a personal trainer, also former Pro Bowl running back in the NFL. And today we've got Dr. Austin Davis, who is a chiropractor. We're going to tinker with that article in a second. He's a chiropractor, a doctor of chiropractic medicine, and been practicing for quite a while now up in Northern California. He also, on Twitter and on Instagram, I don't know how he was able to get this handle. He must have done a handshake deal specifically with Jack Dorsey on Twitter, but he is the chiropractor on Twitter and Instagram if you want to follow him. I'm a little bit remiss because I did not get his contact information put out there while we were doing the show. And he's interested, if people are interested, in answering questions. If you have a question for a chiropractor, and you'll find out, he's a cool guy. Like, I believe when he says, I will engage your audience if they have a question. But shoot him a line. The Chiropractor on Twitter and Instagram. He's also on Facebook, but he's got kind of a common name, that Austin Davis. Like, there's a bunch of them out there. What I did to find him specifically, I don't know if he's as comfortable on Facebook. That's a little more personal. But put Austin Davis Chiropractor in there, and you will find him. So Dr. Austin Davis coming up. I'll give his email address, too, in the outro. I know I don't want to put it up in the intro here. I just want to make people listen through. But also, I'm not always as comfortable putting people's emails out there. But we'll figure it all out. I looked up to prepare for Dr. Austin Davis. Oh, heck, I'll give you his email. I pulled it up here. It's Life Chiro SF. Life, L-I-F-E, Chiro, C-H-I-R-O-S-S. Life Chiro San Francisco, basically. lifechirosf@gmail.com. And lifechirosf.com is his website. So you can find them at either of those. I was actually stalling to find that. That's why I said I'd put it in the outro because I couldn't put my hands on it right away. Anyway, to prepare for Austin Davis, lifecairosf.com is where you can find them. I looked up. This is how you mash together 4 sentences and just make one continuous stream of thought out of it. I looked up, and this is on a website called topinspired.com, the top 10 types of alternative medicine. And this, I believe, is by people who practice these. Well, I don't know if these are in any particular order. I couldn't find in the article how these were ranked, but they are perhaps just listed, not ranked. And they're not, oh, well, wait a minute. No, they're not even alphabetical. They were for a minute there. I'll just kind of buzz through them from, I guess, 1 to 10. If they're not in any order, I won't save the number 1 for the end. But let me do 10 to 1. This is a production meeting you and I are having on the fly, which happens often because my thoughts are organized like a swarm of bees. But I will go 10 to 1. Just you'll find out why in a second. But number 10, the top 10 forms of alternative medicine or alternative healing. I don't know, healing is kind of the word that world uses, but top 10 types of alternative medicine is the name of the article on Top Inspired. Number 10 is meditation, which I would imagine is fairly highly practiced all over the world. There's a bunch of different types of meditation, but lowers blood pressure, fights depression, fights anxiety, kind of gets you in touch with the here and now, presence, mindfulness, right? Number 9. Straight from Nikki Estes' mouth to your ears via the commute on January 1st, yoga. And yoga, very popular. There's yoga studios all over the place that were affected by the pandemic. Hopefully they'll get up and running pretty soon. But interestingly, a survey released in 2008. Now, this article's from 2019. A survey released in 2008 by the U.S. National Center for Complementary and Alternative Medicines found that Hatha Yoga was the 6th most commonly used alternative therapy in the U.S. And as any of you will remember, Nikki Estes taught me all kinds of words that I'm fairly certain she made up while she was talking to me. Number 8, homeopathy. Homeopathy. It's herbs, supplements, those kinds of things. It's an alternative treatment to pharmaceuticals, I believe, if I'm reading that right quickly. Number 7, acupressure. Interesting. Similar to acupuncture because it's based on life energy. But instead of using needles, acupressure is applied by hands or elbows. It can relieve nausea, vomiting, back pain, headaches, stomach aches. It may not be as effective as acupuncture, but it can provide temporary relief. And I'll say this. I remember when I had a bad toothache, someone told me to squeeze the muscle between the thumb and the forefinger. And I'll be dipped, it worked. I'll never forget that. I was like 10 years old, and someone showed me that acupressure point, and I'm like, oh, okay. Number 6, herbal medicine. All right, this takes away my explanation for number 8, homeopathy. Herbal medicine, are you sitting down? Using herbs as medicine. Number 5, Reiki. This one I'm a little more skeptical of. Life force, energy. You know what? I'm going to try to get a Reiki master. I don't know any personally. I've known a few people that really buy into it. I didn't use the word believe in it there. I'm not sure that that's the right word, but buy into it, that they say it works. I've never honestly had it done. So I don't have a whole lot to be skeptical about as far as data goes, but it's a little weird for me, the chakras and the energy fields, and I'm like, okay. Anyway, we'll maybe get a Reiki master to talk about it in a way that is not skeptical. Number 4, one that I think, all right, now we're getting a little off the beaten path here, magnetic field therapy. This uses magnets to treat illness. Okay, I'm not going to get a master of that. Number 3, well, dadgum, these all kind of overlap in my head. Energy therapy. All right. Uses human energy in order to release tension and everyday stress. It is the art of clearing cellular memory through the human energy field. Okay. I am going to dismiss that one outright. I'll buy into Reiki. There's a little bit of research with that, I know, but energy therapy, man, that's a bridge too far for Dr. Steve. Number 2, one I buy into completely, as will Dr. Davis, chiropractic medicine. He'll talk all about it in a minute. And number one that I'm curious to try, because I do think there's something to this, but acupuncture. Like 3,000 years of Chinese medicine can't be completely based on nothing, right? So I've never tried acupuncture. I will at some point because I'm just insanely curious about it and quite hopeful that it can work to do something. I don't really have a malady that it can fix, but I'm curious. Anyway, we'll get an acupuncturist on, too. I've tried a couple, but haven't been able to grab one yet. But I'd love to have a conversation about it. Hey, I will say this, as we get moving toward Dr. Davis, the best therapy for the commute and Dr. Steve? Patreon.com therapy, baby. Toss $1 a month into the fare meter. Come on, you got $1 a month. Look around, check the ashtray, look under the driver's seat. I'm sure you've had a few quarters slip out of your pants pocket while you're driving. $1 a month to support the commute. Patreon, patreon.com/the commute. $1 a month, $2 a month. Hey, if you toss a $5, you get a commute mug. $10 a month, you get a mug and a t-shirt, and for $1,000 a month, Austin Davis will come and give an adjustment like to your whole family and your extended family and friends of your family and everyone in the community. I'm not sure he's got that kind of time. I'm not sure he even knows that I'm volunteering him for this, but the point is, patreon.com/the commute. Now let's get to a real therapist, Dr. Austin Davis. Hang on, everybody. All right. From the sovereign nation of Northern California, we've got chiropractor Dr. Austin Davis joining us as we continue on our path of health and wellness in 2021. And Dr. Davis, Dr. D, thank you so much for taking time out of your day to come on to the show.
Oh, it's an absolute pleasure. Thank you so much, Steve, for having me. I appreciate the opportunity.
Dr. Davis is a chiropractor, and I think that's it. It's not like doctor of chiropractic medicine, or what do you go by exactly? What's the handle?
So there is a lot of debate around this. Technically, I would be Austin Davis, DC, which is Doctor of Chiropractic. To say Dr. Austin Davis, DC is a bit redundant.
Doctor.
Yeah, exactly. So it's just Austin Davis, DC. Obviously, some chiropractors as primary healthcare practitioners want the doctor in front of their name, so they'll just go by Dr. Austin Davis and then leave off the DC. So it kind of depends on how the doctor wants to frame it.
All right. We'll and I'll at least underscore this by saying I've been going to chiropractors most of my life. My father did. So I say this with as much love and respect as possible. But my dad still refers to you as the bone crunchers. So
he is not alone. That is a pretty common name that we get.
Well, just before we get into chiropractic specifically and what you do for a living, just give me 2 minutes on you. How'd you grow up? Where'd you grow up? How'd you get interested in this stuff? And when did you make the turn to becoming this as your career?
Well, it was one of those opportunities that was always right in front of me, and I took a very meandering path to get here. I am from a chiropractic family of sorts. My grandfather was seeing a chiropractor in New York. I'm from the East Coast, from New York and Connecticut. My grandfather was seeing a chiropractor in New York when it was essentially illegal that he would have to bring a radio into a radio repair shop and get a little special ticket and go down into the basement to get adjusted.
Are you being literal?
Yes.
Wow.
This is the chiropractic, it may surprise you, was not illegal, but was kind of in the shadows almost up to the 80s. The AMA, the American Medical Association, there was medical doctors that were losing their licenses by referring patients to chiropractors all the way through the 70s. Yeah.
Okay.
So although we are in the limelight now, it was in the not too distant past that it was complicated for us. So my father's a chiropractor. My uncle, actually 2 uncles, a handful of cousins. At one point, I think there was 10 of us in the immediate family. So it was always around. It was our family network, but it was never pushed on me as, well, when are you going into chiropractic? It was, my father's motto was always, you're the one who has to go to work, so do what makes you happy. And I tried a handful of other actually hands-on type professions. I cooked in restaurants. I was a photographer when dark rooms were still being used. I did hands-on type work. I did construction to help others, and it just, nothing ever resonated with me until I chose to give chiropractic school a try. And from the first moment I went, I knew that it was my ultimate purpose in life, and have followed it now for 12 plus years.
It is certainly your birthright from the sound of things. Wow.
Birthright indeed. In fact, the first chiropractic adjustment ever given was September 18th, 1895. We can talk about that story in a minute if you want. It was an African-American janitor who had lost his hearing after reaching for a bucket or something and felt a pop in his neck. And the first chiropractor ultimately adjusted him, probably very crudely. His hearing came back. But that September 18th date is important because that is also my birthday.
Wow. Actually, I just read that story on Wikipedia to prepare for our conversation here. Yeah. That's interesting you brought it up.
Well, it's pretty fascinating. So it was Harvey Lillard was the janitor, and Dee Dee Palmer was kind of hard to call him a chiropractor. He was an anatomist and a magnetic healer. He was very deep into the human sciences, and believe it or not a lot of doctors were seeing African-American janitors in 1895 in Davenport, Iowa. So Dee Dee Palmer took a look at him, and when he found a misaligned vertebrae, what we call now a subluxation, he very crudely said it. It was Dee Dee Palmer's son, B.J. Palmer, who developed the art of adjusting and really a lot of the science into what we do. But over the course of time and a few adjustments, his hearing came back. And Dee Dee Palmer thought he had found the cure for deafness and asked everyone to send him their deaf patients and relatives. And he never replicated those findings, but started to get reports back that heart conditions were improving and digestive conditions and sleep conditions and every other condition started improving, and then started to put it together that if your body is controlled by a central nervous system, and that central nervous system is housed in the spine and communicates to the body through the peripheral nervous system, and any of those spinal segments deviate their alignment, which is incredibly common and easy.
Yeah.
In fact, as early as birth, this occurs. It can impact the way those nerves communicate. And if you impact the way nerves communicate, you then impact how the body functions, and you become dysfunctional. And that could be as simple as pain or as complex as behavioral disorder or digestive disorder, hormonal disorder. It's all related to how the body is able to communicate. And that's ultimately what chiropractic is a study of communication through the nervous system and how we can correct interferences to allow the body to communicate the way it was designed to.
To someone who doesn't go to chiropractors, this all sounds like woo-woo or hocus pocus, but I remember the first time I ever went, my neck was screwed up, and the chiropractor said, I'm going to put it back in place, but you might get sick because your immune system is going to take a hit when everything gets adjusted. And I'll be darned, he was dead on accurate with that. I got a cold, and I came back sniffling. He said, I told you so. But that sort of made an impact on me on how all the systems of the body are not plural. It is a system. And when you alter one part, it's like a mobile over an infant's crib. If you kind of bap one of those parts of the mobile, everything else shakes. And so, anyway, I'm just sort of underlining what you're saying.
Fantastic way to put it. No, I've never heard that analogy, and that's incredibly accurate. It's whenever we hear someone say, "Oh, thankfully I've never needed a chiropractor," or "Oh, I don't really believe in chiropractic," it's a great learning opportunity. When they say, thankfully I've never needed one, it's just a fundamental misunderstanding of what we do, because that's an assumption that it's pain-based and they're just glad that they're not in pain.
Right.
But like what you described, I often tell patients after the first visit, I say, you know what? You may actually experience more discomfort today as your body adapts to new alignment, as nerves start to function at a higher capacity. Pain is not really our marker for success. A function is. So pain or discomfort, or even like you said, a cold or something like this, is a sign of change. It means something is occurring in the body, and the body is designed to process and analyze and deal with these things. So it's not always a terrible thing. And when they say, well, I don't believe in it, then I say, well, do you believe in gravity? I mean, if you
my answer is always, do you think it's a religion?
Yeah, if you didn't believe in gravity, would you float away? If I laid you on the table and adjusted a misaligned segment, whether you believe you're going to get better or not, your body will take that increased nerve capacity and you will be better whether you believe it or not. So it's a fundamental universal law, essentially, is interference to a communicating system creates dysfunction. So if you correct that interference, you're ultimately correcting the dysfunction. And obviously there are many factors. There's environmental and chemical and emotional and physical. And chiropractic deals with mostly that physical, which leads to chemical interference.
Well, let me ask you, when somebody comes in, I'm guessing most people come in because of pain to see you for the first time.
Right.
But what are you assessing when you're kind of are you watching how they walk? Are you watching how they favor? Are you what are you doing during that initial meeting?
Right. So we always want to have what's called concurrent findings. So we do visual assessment, we do motion assessment, we do what's called applied kinesiology, which is relatively simple muscle tests, which test the nerves that go to those muscles, and applied kinesiology is really fascinating. And as you continue to do your health series, to find some dedicated kinesiology practitioners would be actually a really interesting interview as well.
That's a thing?
Oh yeah. So it's a major diagnostic tool, kinesiology. And there's even chiropractic techniques called AK, which is applied kinesiology. We do imaging. So there's digital x-ray, and then other chiropractors use all manners of imaging. There's devices that give you readings on neural output on the spine, of heat readings. So we're doing essentially a lot of visual, a lot of motion, and a lot of imaging. And once we get at least 3 concurrent findings, it starts to give us a lay of the land of what is out of alignment, how it may be affecting the body, and what's acquired and what's congenital. Some people have issues they were born with. Some people have them from injury or ergonomics.
And you're also kind of feeling the spine and the neck with your fingertips, right?
So that's what's called palpation. Yeah, palpation is a big part of what we do as well. And on the outside, it looks like we're basically just feeling the spine. And what we're doing ultimately is it's tone-based palpation. So essentially we're testing one muscle compared to the other. So if the left paraspinal muscle, which is that muscle that runs basically from the back of the head all the way down to the pelvis, right tight along the spine there. So if you run your finger along your spine, you feel those little bumps. Those are what's called your spinous processes, or it's the little fins that stick off the back of the bone. Now, right alongside of that is your paraspinal. So if we're palpating, for instance, we feel that the left paraspinal is hyperactive, is basically locked up like a rock. Left paraspinal, or whichever one, is hypoactive. Then we know that there's some tonal imbalance, and that could be due to muscle fatigue from ergonomics, could be a neuromuscular issue, could be psychosomatic, but it starts to give us points to dig deeper into. And so that palpation is important to give us one part of what we do.
So you're not feeling like individual nerves coming off of the spine. You're checking the tenseness of that muscle, both sides.
Exactly. And the response of that muscle. So if we put some pressure on that muscle, it should kind of give back a little bit. And if it doesn't, that tells us something. And if it does too intensely, that tells us something. But no, actually, we're not able to feel individual nerves. The nerves are pretty deep in the body. and pretty protected with soft tissue and covered up. So we're not feeling for nerves specifically, but rather what the nerve goes to. And then we can start to put together what that nerve is doing based on the components that nerve innervates. So if they come in with a heart condition, shoulder weakness, a limited range of motion in the cervical spine, we can start to understand which nerve is being affected, because one nerve will help innervate the heart, the shoulder, neck muscles. And if we know that bundle is affected, we know exactly where that comes from. Then we can confirm with imaging, with kinesiology, with motion palpation, and then start to make our adjustments from there.
Wow. You're teaching me all kinds of big words here, too. That's nice. So how many targets are there? I imagine there's sort of a finite number of places that you could focus on. Is that accurate, or is it sort of I don't know. It just seems like there's only so many joints that could be wonky, but that's my layman's appraisal.
No. Well, yeah. Wonky joints are.
See, I'm not going to use the orthogonal or palpative.
Yeah,
or
no,
what.
That's fine. So subluxations, it's also kind of debated within our profession. There are chiropractors who practice what's called upper cervical chiropractic, and that is literally, as it sounds, the back of the skull is called the occiput, and then C1 and C2, so atlas and axis, are the first two bones. And there are chiropractors who will only adjust those segments. That's it. They make one adjustment, and that's it. And upper cervical chiropractors view that as the only true subluxation. Everything else is a misalignment or a compensation. There are people like myself that are full spine doctors that we view a subluxation as any misalignment that directly impacts the central nervous system. So the seventh bone of the thoracic spine deviates to the left, the central canal gets occluded, the central nervous system goes through there, you have direct impact. If you dislocate a finger, you misalign a wrist, I can set that wrist, but to me that's not a subluxation. It does create pain, it does interfere with peripheral nerves, but it doesn't directly impact the central nervous system. Right. And then there's chiropractors who do internal nasal adjustments, where your sphenoid bone, which is the bone internal to the skull that touches all the other bones, and they'll go in there, they'll loop in literally like a balloon into the nasal cavity and pump it up until it crunches into place. I've had it done. It's one of the more aggressively painful adjustments, but I'll tell you this, afterwards, it was one of the best feelings I've ever had in my life. I played collegiate lacrosse and hockey. I was a competitive backcountry snowboarder. I've had a lot of trauma and injury. In fact, what brought me to chiropractic was I was a goalie in hockey growing up in Connecticut, and I was playing hockey. I got kneed in the back of the head while I was making a save, and I woke up in an ambulance. Ultimately, ended up at the hospital where they did x-rays, because I was basically knocked out, but I was also not moving my arms very much, and I was not moving very much. So they did x-rays and found a compression fracture of C5, so the fifth vertebrae of the neck. That C5 has the nerves which go to the shoulders and the beginning of what's called your brachial plexus. These are the nerves that go down the arms, but some of these nerves also go into the organs of the, head, neck, shoulders, chest, all this area. So my father, being a doctor, said, can I see the x-rays? And he saw them and he said, what's your recommendation? And the medical doctor had said, well, we need to do at the time, maybe it's not common anymore, but we would need to do a fusion type surgery where we need to stabilize that fractured segment. And I was probably 12, 13 years old at this point. Hadn't hit a growth spurt yet. I was like 5'2" or something. I was a little guy. Yeah. And I'm 6 foot now, but had they done that fusion, one of a few things would have occurred. It would have obviously stunted my growth. But my father said, well, what about these subluxated or misaligned vertebrae that are out of alignment? What if you fuse these out of alignment? What happens to the nerve capacity for the rest of his life? And I get goosebumps now. It chills me to the bone. I remember clearly to this day the words of the medical doctor. He said, "Oh, we're not really taught to look for that. We need to take care of the big, scary stuff. And there's a fracture there. We need to stabilize it." So, which I get. And this is the importance of the medical industry is emergency care. This is where they excel.
Yeah.
When there's a fracture, there's a bone sticking out of the skin. If someone is going into anaphylactic shock, I mean, there are very severe and significant conditions that the medical industry is perfectly suited for. Now, the other issue we end up seeing is if they are not addressing spinal misalignment, no matter how seemingly insignificant that misalignment is, it has the capacity to impact the nervous system. So I would have had a fusion surgery as an adolescent that would have potentially put pressure on my nerves for the rest of my life. And they have, methods of taking care of this. They have painkillers. There's future surgeries. There's physical therapy. But none of those things will truly address the cause of the situation. It addresses the symptoms.
Yeah.
And if the cause is cervical misalignment or vertebral misalignment, the most responsible and thankfully simplest approach is to go to a health professional who can realign those segments simply to allow the body to just communicate and function the way it's designed to. There's no magic in what we do. There's no big secret. It's really just detective work. It's figuring out what's not communicating, why, and if we can address it, correcting it.
I want to get back to that upper cervical in just a second, but let me continue down this path for a second. So
Yes.
you, as a 12 or 13-year-old, I'm guessing you're pretty fit to be a hockey player. So if we just go by the theory, or not the theory, but what you mentioned before, that you're testing the strength of the muscles on both sides of those vertebrae. If your bones are out of whack for too long, won't the muscles kind of be trained to pull your bones out of whack in the future if you put them back into whack? Pardon my use of big words, but
No, if I'm understanding correctly, and stop me if I'm not.
it was a convoluted question, but go ahead.
The body works in patterns. And what we often see is someone goes to a chiropractor for pain, like we talked about earlier. Unfortunately, that's where we're at in society. It's just, to be honest, it's chiropractic's fault that there isn't more readily available, easily digestible information. So first off, thank you for doing things like this.
You're welcome.
To teach people that chiropractic is not a Band-Aid. It's not about, oh, you have a headache, stop in, get cracked, and then head out and check in again in 6 months when you have another headache. That's Tylenol. That's Advil. That's what drugs are for, is to help you get through the day or whatever.
I'm going to quote you out of context on that one too. Drugs are to get you through the day.
And that's basically what it is. It's the way I explain it to patients is that drugs are paying the interest on your credit card.
Ooh,
You're gonna get
nice.
You're going to get through the day, maybe through the month, but eventually that catches up with you, and then you're in a world of pain. So chiropractic is a process. It is, unless it's just outright trauma. I do a lot of rib work, and not a lot of chiropractors do a lot of rib-specific work, but I do a lot of rib work, and it's not a subluxation, and a lot of chiropractors will tell you that it's just misalignment, and that's fine. But we see a lot of athletes, and we see a lot of children, and often rib misalignment is a big issue. And if you fall off a jungle gym or you twist to get something out of the back of your car, you feel that knife-like pinpoint pain in the back or like a crushing pain in the chest, like someone's sitting on you, chances are a rib has deviated its alignment. And I can set that rib, and almost immediately the person will feel night and day better. It'll be sore, but the sharp pain, the big time pain is gone. So in that regard, yes, we can have a pretty direct and immediate impact on a patient for the rib. Now, just about everything else in terms of insidious onset or pattern-based conditions, to realistically think that you could walk into a chiropractic office, get adjusted after 15 years of crappy ergonomics, stomach sleeping, just fatigue patterns, emotional distress. I mean, all the crap that builds up that distorts the system, and get one adjustment and go, oh, this better be it. I better be fixed, is unrealistic. That's not how health works. That's not how patterns work. It's a process. So the reason we do all of our findings, do the imaging, do everything, is that we want to see with reasonable certainty that how long it's going to take. And for most people, they're a little bit shocked when they hear, oh, my chiropractor wants to see me twice a week for 8 weeks or for 6 months or whatever. They're like, that's ridiculous. And it's like, okay, well, I could see a patient twice a day, 5 days a week. And if they leave my office and sit at their computer for 10 hours, curled into a C shape with their chin, 3 inches out in front of their shoulders and their legs are crossed and they're, drinking sugar, sodas and eating crap and all this stuff, to think that that adjustment is going to have the major difference that's going to change their entire life, they're partly correct. They'll always be better off to have more nerve communication, but they're going to fall back into these old patterns. And there's responsibility on my part as a doctor to understand what's going on with them, how we can address it. And there's responsibility on the patient's part to make some changes in order to create a healthier environment for themselves. But it often takes time because we adjust the spine, and there is the capacity for it to fall back out of alignment if they go back to their old patterns, or if the body goes into a stress state, which, believe it or not, most people are living in what's called a sympathetic stress state. And that stress state causes the fight or flight mechanism to kick on. Fight or flight means save all your energy for running or fighting. So the body goes to path of least resistance, starts to go back to these old patterns because it takes less energy to stay in that pattern. So what we're seeing today, especially with this whole last year of lockdowns and people losing jobs and the stress of everything, is, even to be honest before that, but especially this last year, is we're seeing a lot of conditions related to the fight or flight patterns of the body. And when you go into a sympathetic pattern, your adrenal gland kicks on. It also triggers what's called your psoas muscle group, which is one of the deepest low back muscle groups. It attaches from L1 to L5, then wraps around through the hips and into the legs. And when that activates, it signals your reptilian brain, a primitive brain center, that you're in trouble. So people sitting all day now at home without proper ergonomics, because maybe their office provided them some ergonomics, but they're working from a coffee table or from a kitchen counter or something.
Right.
Their psoas muscle fatigues and locks up. Even if they're having a great day, it's going to signal to the brain that they're in trouble. It then fires off your adrenal gland. Now, if you have adrenaline pumping through your system, believe it or not, it's pretty difficult to get a deep night's sleep. You're not getting a restful sleep. You're sleeping with one eye open mentally because you're in trouble. It's also, you're not going to be digesting food properly because your body needs that energy to run or fight. So what we start seeing is people with digestive disorders, sleep disorder, adrenal fatigue. When you have digestive disorder, you have issues going to the bathroom. That low back psoas muscle group goes through all those low back nerves, like the sciatic nerve. You get restless leg. You can have erectile dysfunction. You can have excretory dysfunction, digestive, all of it. And unfortunately, they usually go medical first, which means there's a specialist for each one of those things I named, which is going to give them a little drug or something to do for each one of the things I named. And in reality, it's linked to one central system. It's linked to that sympathetic nerve system response. Chiropractic has been clinically proven to help shift the body back to a parasympathetic state, especially with cervical adjusting. So we can help shut off that that adrenal gland and shut off that sympathetic pattern, which would allow them to actually get some deep restful sleep, start digesting food, basically go back to normal functioning humans. But it also requires some mental work, some emotional work, and that's the hard thing for people to face. But it's so multifactorial that what we do, and we don't claim that it's chiropractic and nothing else. We just say that it's a baseline. We want to reset your system so it communicates properly. On top of that, do all of the good things that are in existence for your body and for your mind. But it's important to do those things with a system that can adapt to those practices properly. So do yoga, eat better, do art and dance and sing and swim in the ocean and do amazing things for yourself. But if you're only doing those things without ever checking to make sure the body can integrate that properly, you're wasting a lot of time, money, and energy on inefficiency.
Wow, that was a great answer to my somewhat nonsensical question. Thank you for that. You actually did interpret the question properly. And I'll just say, to sum that up, I wish that there was a different word pairing for what you're describing beside sympathetic and parasympathetic, because I think people hear sympathetic and they think the emotional, empathetic kind of sympathy.
I know, it's odd. So just think sympathetic starts with S. So sympathetic, stress. Parasympathetic, there's no clever way to do it. It's just relax. So sympathetic, stress. Parasympathetic, relax. And that's the way to look at it. Stress state, relaxed state. It is odd that sympathetic, you would think it's actually like the opposite, but your sympathetic state is your stress state, your parasympathetic is your relaxed state. And basically every organ of the body has dual innervation and will function differently based on what state your body's in. So it is absolutely imperative to find practices that help shift your body to that parasympathetic state, because you want to keep your sympathetic response, your stress state response, as a break in case of emergency, because again, it's fight or flight. And most people are running in that state all day, every day. And when they crash on a Wednesday and they go, oh crap, how am I going to make it through the week? I'm crashing. I feel totally tapped out. What they're really doing is their adrenaline is wearing off and they're coming back down to like normal human levels, but it feels like they are hitting rock bottom. They're not. It's just they're used to running on adrenaline. So it's kind of shocking when they don't have adrenaline in their system.
Well, and I think it would surprise people to know how caffeine works, because caffeine doesn't just magically make more energy appear when the caffeine fairy puts some dust on you. It tickles your adrenals. Like, that's where that energy comes from.
Exactly right.
So all the coffee junkies are actually, over time, kind of depleting themselves rather than energizing themselves.
Exactly. And coffee is also a dehydrator. So most people that are chugging coffee usually aren't also chugging water, unfortunately. And you end up with dehydration headaches, caffeine headaches, and you end up getting these headaches, which most people then have medication for, or they do something like yoga, which is great. Yoga, the fast, and you had a woman on already who discussed yoga, so I'm sure your listeners know all about it.
She taught me some words too. Yeah.
Oh yeah, absolutely. I mean, but a big part of yoga is the inversion training. So the poses where you go inverted.
Yeah. And
the really unique thing about that is your brain creates what's called cerebral spinal fluid. And this spinal fluid bathes the nervous system and creates basically communication efficiency. Now, it gets all the way down to the sacrum, the bone at the very bottom of the spine, the big anchor-looking bone. And there's what's called the sacral pump. And human beings, which are designed to be dynamic, active people, just from moving around, that pump pushes all that fluid back up through the system. Now, our society has become less and less dynamic and more stationary.
Uh-huh.
Right. And what ends up happening is you get this sacral pump stagnation where that spinal fluid is not getting pushed back through the system. And that creates a lot of its own sets of dysfunction. But it creates things like pain, discomfort, and all of that. Now, so people feel stuck. So they go do yoga. And the inversion puts their sacrum above their skull, and it basically, using gravity, forces that fluid back through the body, and they leave yoga going, I feel amazing. This is incredible. Yoga's the best. And it is fantastic. But what they're experiencing is movement. And that's like the biggest part of yoga for people without them realizing is just move around more and your body will naturally pump this fluid back through your system. And obviously use yoga as a focus, a meditation, a breath work. You know, it helps obviously with stretching and ligament laxing and all this, but so much of that euphoric feeling of yoga is simply movement because of its ability to impact that sacral pump that for most people is just stuck. And if it gets too stuck or subluxated, this is also where chiropractic comes in, is sometimes that sacrum is just locked into the SI joints between the hips and you're not getting any what's called nutation or rolling movement of the sacrum. So even if you are walking, it is inhibiting that pump as well.
Wow, that's cool. And
Really cool.
You and I are going to start a band called Sacral Pump Stagnation. I love that.
That would be a great name.
First album would be called Subluxation. But
Perfect.
let me get back to this upper cervical thing.
Yes.
Knowing that you and I both have a cervix, I think that's the takeaway from this conversation. But the interesting part of this to me is I've actually experienced this when my regular guy was on vacation and he sent me to a different guy who just like put his forefinger at the bottom of my skull and went boink. And it almost felt like somebody running their thumb down a piano or like a xylophone, just brrr, everything kind of went into place. And I'm like, how the hell did you do that? But is there, I guess, it sounds like you don't do this necessarily, but I'm surprised that there are two schools of thought. If one works so well, if they both kind of work, I don't know. One should be the predominant philosophy, but I guess they both have merit.
Right. And this is the bit of the complicating factors. Thankfully, all chiropractic techniques work. It's removal of interference from the nervous system that will always help improve communication. So they all work. Then it comes down to personal preference. Some people, to be honest, full spine adjusting like I do is tough on the chiropractor's body.
Oh, I can't
So when
imagine.
we're seeing patients, and there's what's called high volume offices where people will see, 600, 800 visits a week, or 1,000 or 1,500 visits a week. And if one doctor is adjusting in that capacity and moving hips and moving thoracic spine, I mean, you can, and some of these people is, there's full gamut of body sizes and shapes. It's exhausting. Chiropractors routinely blow out shoulders, wrists, have hip degeneration, all manner of issues. So it's physically taxing on the body.
Okay.
Now, that's not to say that every upper cervical doctor does upper cervical because they don't want to wear their body out. That's not accurate. But it is a factor. Now, there are some that, as you get deeper into the philosophy of chiropractic, so chiropractic essentially is a science, an art, and a philosophy, and all three need to be present for it to be ultimately chiropractic. And I know that sounds a little odd, and we can touch on that, but essentially the practice of it and the philosophy of it is that the atlas, the first bone of the neck, has the largest bundle of nerve fibers going through there. So that is the most important vertebrae to focus on.
Okay.
And there's some people who are completely content stopping there. And that's a big part of the upper cervical spine going, I got into this to have the greatest impact on the nervous system. That's the atlas. That's all I want to study. And they stop there, and it's amazing. It's really amazing work. And I saw what's called a Blair practitioner. So it's Blair.
It was in the woods in Maryland. Yeah.
Well, so I saw a Blair practitioner out here in San Francisco, and he was a classmate of mine. And because I get from the compression fracture, which is stabilized, but there are certain times where I'll get pretty debilitating headaches, migraines, where it's like lightning storms in my head, and I can't function or focus too well. So I went and saw him because his specialty is upper cervical, which is a little above C5, but with the amount of concussions I've had, I've got my bell rung plenty of times. So I go to see an upper cervical specialist. And I'll tell you this, I used to wear glasses for driving, especially at night, for far distances, but all the far away stuff. I went to, I think, 6 visits with him, and all of a sudden my glasses were making my eyes hurt. And I went and got them rechecked, and my prescription was literally cut in half. And I have both tests I could show you both tests that within those 6 visits, my whole prescription cut in half. And what had happened, and what this chiropractor explained to me, was basically my upper cervical misalignment was putting pressure on my optic nerve and causing ocular dysfunction. As he cleared that, my body went back to functioning at whatever normal is for me.
Right.
And my prescription was cut in half. The corrective lenses were not correcting the interference to the optic nerve. They were correcting the symptom of my optic nerve being altered. So once we cleared that, now I don't need glasses for driving. I wear them sometimes at night if I'm very tired, but in fact, I don't even know where my glasses are anymore. But it has
He's got to work on your memory next, Austin.
Right, yeah, exactly. But it's shifted that. So part of it is, pain and dysfunction. The other part of it is actual systemic disorder, and that's what I was experiencing. And
without even knowing it, that's the fascinating part.
And I'm a chiropractor, and I'm from a chiropractic family, and so it is common for people to go in for pain and for symptoms and this kind of thing, and it shows us that the educated mind will never be greater than what we call the innate mind, and it's that universal intelligence that has created and unites all matter. And you can say that sounds a little airy-fairy and woo, but this is the fact of the matter, is that we are beyond fortunate to even exist based on the amount of factors that go into that. So the intelligence behind that is staggering. And we read a couple books and we listen to some podcasts, we do whatever, and we think we know enough, or we know as much as we need to. And the fact of the matter is that there's so many factors outside of our educated intelligence that if we could start to just sort of be open to the capacity that the system that functions inside our body that was created when a sperm met an egg and now you exist is always going to be so much higher capacity than your educated mind, that the best thing you can do is allow that system to communicate, because it will always be smarter than you. Thankfully, smarter than you.
Well, I feel a lot smarter and one step closer to enlightenment, because I can drop sacral pump stagnation into conversations for the rest of the day. That was, I don't even mean to put a punchline at the end of that. That was well put. I'm glad, I don't know if you riffed that off the top of your head or if you've said that a few times, but that was really succinct and well put, Austin.
This is my life. It's not, I have no scripts or anything. I do a lot of speaking, especially to students and schools and this kind of thing, but this is what I grew up with. This is health education as I know it. So there's a lot of people I think that are good doctors, and at the end of the day they close their office up and they leave and they go about being whoever they are outside of their office. I choose to live chiropractically, and what I mean by that is just try to be as in tune with my innate intelligence, with universal intelligence as possible. And just because I leave my office doesn't mean I turn off and I'm someone else. It's congruent with the way I live. I want to live as in communication as possible, internally and externally. And, the Palmer family who created chiropractic, ultimately, that was their vision for chiropractic. It wasn't to get people out of pain. It was to create highly functioning societies that if you have a subluxation of the upper cervical spine and it's altering your hormone release and it makes you more aggressive as a person, or makes you shut off or distant at work, you're probably not doing very well. You may get passed over for a promotion, or you may get, a reprimand or something like this. And their vision for chiropractic was, if we could clear people's systems so they communicate at a higher capacity, they function at a higher capacity, they operate with a little more patience and compassion and love, that ultimately would help keep families together, keep people out of trouble, start to clear out society's interferences. It would lead to a higher functioning society. And I know that's kind of esoteric for a primary healthcare profession, but that was the ultimate goal. Was disconnected, subluxated people tend to not act in a clear-minded, connected, loving way with themselves and with others. And pain does very funny things to people. And these days, pain, which is chemically medicated, does even more detriment to people ultimately in the long run than good in terms of the day-to-day healthcare. Like I said, medical is great for emergency care, but to constantly bombard the system with chemical interference and expect it to function at a higher capacity doesn't seem realistic when you really look at it.
That is a great note to end on. Well, boy, nice bookend technique there. Dr. Davis, I appreciate your time so much, man. And I'm sure your message to everyone is to keep that sacral pump dynamic, right?
Keep the sacral pump dynamic and keep the atlas in alignment.
And
That's
to that, I shrug. Yes. Well, Dr. Davis, I got to let you go. But, man, thanks a lot for being on the show, brother.
Really, my absolute pleasure. Again, thank you for this opportunity. And I hope in the future, if questions do come from this or you get any feedback, please let me know. I'm always happy to answer questions, even if they're tough, difficult questions. It's so important that we get this education out there. So, again, thank you so much.
Chiropractor extraordinaire and knower of big words, Dr. Austin Davis. Thanks, man.
My pleasure.
All right. Austin Davis, as soon as we hung up, he was like, can I give my contact information? I'm like, oh, no, I forgot. The Chiropractor. It's that simple, man. Twitter and Instagram, The Chiropractor. He is on Facebook. Steer clear of that. That's his personal stuff. Go to lifechirosf.com or lifechirosf@gmail.com if you have a question. And he's real engaging, super friendly. Like, it took us a while to work out the scheduling, but he hung in there and he was like, I'm available today. And I was like, oh, well, I'm snowed into my house, so okay. And it was kind of an impromptu thing. He was still fantastic. Thank you to Dr. Austin Davis. Hey, get the music going. Yeah, I gotta yell, because these kids, they don't pay any attention anymore. All the music you hear on The Commute, compliments and courtesy of the Free Music Archive. Visit thefreemusicarchive.org. Keep the music free and available for the world to enjoy. On Monday, we get back to Music Monday, and Paul Monroe will step aboard the tour bus. Drummer for XYZ. Inside Out. And When I Find Love. Oh, bitch. Anyway, I could go on and on. You know I could. Next Thursday, we're going to get either Phil Johnson, master electrician, or get back to Holly Griffith, the NASA engineer. I'll figure it out. You'll be here. It's going to be great. Thank you to everybody for listening and supporting. Thank you to all my Patreon patrons. Thank you to Dr. Austin Davis. And until we meet again, we'll come face to phone Monday morning. This is Dr. Steve driving the bus saying, keep it between the white and the yellow. Have a good weekend, everyone. Thanks.
For a schedule and list of upcoming guests, visit the website thecommutebus.com. That's thecommutebus.com. And for all official swag, apparel, and gifts, visit the official Commute store at teepublic.com. That's teepublic.com. And search for The Commute. And lastly, to support the show, please pledge at patreon.com. That's Patreon, patreon.com. Different tiers mean different cool stuff for you. Thanks for listening, and go to work.